Winsome Perkins, and I'm an FNP student at Long Island University, Brooklyn campus. And today I will be doing a head, ears, nose, throat, head, ears, nose, and throat assessment. This here is my patient, Mr. Scarlett. He is a 20-year-old male. All right, and so far here I have my ophthalmoscope and my otoscope to attach to this device. My eye chart. I have my tuning fork. I have my pen light and my tongue depressor. All right. I have already washed my hands and coming. So Mrs. Scarlett, hi, how are you?
Pretty good. How are you today, man?
Okay. Okay. So today I will be doing an assessment of your head, your eyes, your ears, nose, your mouth, and your throat. Okay.
Okay.
All right. And to start off, I'm gonna inspect. I'm gonna inspect your head. Okay. For any lumps, any bruise, cuts, any. So I'm looking in your hair for any cuts or the hair shaft to see if everything's okay. And I'm also gonna palpate it. All right. Make sure there is no lump, there's no mass or anything. I also check to make sure your head is symmetrical. Okay, it is even. It's not one side is not bigger than the other. Okay, you could sit back a little bit. You're good. So I'm gonna check your face.
Okay.
All right, for symmetry. I'm looking at your face. I'm looking at your eyes. To make sure that there's no swelling, bulging of the eyes, watery eyes. Okay. I'm gonna that's what I'm looking at. I'm inspecting. Now I'm gonna palpate what's called your sinuses. All right. Okay. And I'm gonna palpate your frontal sinus. I'm gonna press up a little bit. Is this painful?
Not at all, no.
Okay. And I'm going to check also what is called your mandibular sinus here. Any pain?
No.
Okay. Okay, so now I'm going to inspect your eyes, okay? And I'm going to look at the color of your eyes, symmetry of your eyes, and to see if there's any swelling or anything, okay?
Okay.
All right. So I'm going to look at I'm going to pull down. Look, you could look up. Okay. And pull up. Look down. Okay. Any burning of the eyes or anything like that?
No.
All right. Next, we're going to check what's called your visual acuity, okay? And I'm going to use this chart. All right. So I'm going to ask you to hold the chart, and you're going to read the smallest line that you can see.
All right.
Put on your glasses, please.
Okay.
Now, hold the chart, and I want you to cover one eye. And read it. And read the smallest line that you can see.
It is LTFPH.
Okay, cover the other eye. And read the same line backwards.
HPFTL.
Okay, thank you. So far, you have exhibited 2020 vision. Okay. Okay, Mrs. Scarlett, I'm gonna check what was called your visual field. All right, and I'm gonna divide. I'm gonna check that in 4 quadrants, right?
Okay.
So you have the upper and lower quadrant and both those sides. Okay.
Right.
All right. So what I want you to do is to look at me, and I'm going to hold my fingers up, and you're going to tell me how many fingers you see, okay?
Okay.
So I'm going to check it on both sides. All right, here we go. How many fingers you see?
I see 8.
Okay. How many fingers you see?
I see 5.
Okay.
6.
Okay. Okay. So, what this does is to check your eyesight in each quadrant.
Okay.
All right. So, what I've realized, what I've found from you is that your your left lower quadrant, there was some a deficit there because I had 6 fingers up, and you said 5.
5. Okay.
Okay. All right. Okay then. Okay. All right. I'm gonna check again your what's called your lateral vision. Lateral vision. Okay. Tell me at what point you can tell me at what point you can see my fingers. Okay.
Okay. Okay.
Okay. Here we go. I'm gonna wiggle my fingers. Okay.
No. Yes, I can.
You can see. Okay.
Yes, I can see.
Okay. So if I want to check to see if there's any deficits, I would do another test where I'm going to ask you to cover your eyes, to cover one eye, and I'm going to cover the same eye like yours, okay? And you let me know when you see my fingers, okay?
Okay.
So cover your yeah. So I'm going to cover this eye, okay?
Okay.
Here we go.
No.
See now?
No.
Okay.
No.
Okay.
No.
Okay. All right. So this. All right. So now I have finished. I've completed checking your visual acuity. Now I'm going to check the strength of your eye muscles. Okay. So I'm going to ask you to look at me, and I'm going to ask you to follow my finger. Okay. I'm going to go in H, make an H pose. Okay. So just follow my finger. Okay. Okay, I'm gonna touch your nose, okay?
Okay.
Okay. So what I'm checking is your eye muscles, all right, and to make sure to see if your pupils are reacting.
Okay.
Okay. Now I'm going to use a pen light to check your what's called your corneal light reflex. Okay.
Okay.
I'm going to shine the light into your eye a little bit there. Okay, I'm going to try this again. Another thing again, I'm going to check your pupillary reaction to light. Okay, to continue, I'm gonna check check the back of the eye, okay, using this ophthalmoscope, okay. So I'm gonna turn up the light. I'm gonna use it. Look at me, and I'm gonna shine this in your eye a little bit. Like this. Okay. Okay. All right. So I'm gonna inspect your ears now. All right. So what I'm gonna do? I'm gonna you could turn. So I'm looking at your ear. I'm pulling up the the what's called the auricle. I'm kind of looking in to make sure there's no redness, no drainage, no bleeding or anything. Okay. I'm going to use what's called the ophthalmoscope, the otoscope, to look into the ear. Okay. Here we go. So I'm going to pull this up. Amazing. Okay. And I will do the same thing for the next ear also. So what I'm going to do here is I'm going to test your hearing, okay? So I'm going to hit this fork and put it on the tip of your head, okay? Here we go. You can hear it on both sides?
No, okay.
You can. Let's see again. How about now?
Yes, we can hear.
Both sides?
On both sides, yes.
Okay, so this is called the Weber test, okay? If there was some difficulty with your hearing on hearing it less on one side, I would do another test called the tinnitus test, okay? And in that test, I would do what's called I will put this on the back of your back of your ear here, okay? So I'm going to do it now. But here we go again. Can you hear it?
Yes.
Let me know when you stop hearing it.
No.
How about now? You can hear it?
Yes, I can.
Okay then. Okay. So I will do the same thing for the other side to check your hearing.
Okay.
This is called bone conduction and ear conduction to check your hearing. Okay.
Okay.
Okay. So the next thing we're gonna is look at is your nose. Okay. So I'm going to use the ophthalmoscope. Okay. All right. So I'm looking at your nose for symmetry to see if there's any flaring of your nostrils. Okay. And I'm going to use this thing to look back in your nose. All right. So can you put your head back a little bit, please? I'm going to open your nose. Okay. I'm checking the septum for any bleeding, any deformity. Okay. Okay. So far so good. Okay. So that concludes the nose section. Okay, so the next thing we're going to look at is your mouth. Okay, so I have here a tongue depressor and I have my pen light. Okay, so I'm going to ask you to open your mouth, please. Open your mouth. Stick out your tongue, please. So I'm checking your mouth for any, bleeding, any sores. Look up the tongue, please. I'm checking under the tongue for any sore or anything. All right. Can you open your mouth a little wider, please? Can you say ah? Okay. I'm checking your the back of your throat for your tonsils, and to see the elevation of the palate. Okay. And I'm also checking your cranial nerve, your glossopharyngeal nerve. All right.
All right.
So far everything looks good.
Okay. Thank you. All right.
Okay, so we have checked the mouth, so now I would like to check your throat. All right. So I'm gonna palpate your lymph nodes. Okay. So I'm gonna palpate your submandibular lymph node here, and some here. Any pain?
No.
I'm gonna palpate the occipital lymph node. Those are along here. The throat. The throat. Anything here? Any pain?
No.
All right. Another thing I would like to check is your thyroid. Can you elevate it a little more? I'm going to look to see if there's any swelling, anything that's going on there. Okay. I would like to check your thyroid. So I would like to go behind you to check your throat. Okay.
Okay.
All right. I would like for you to swallow something also. What I mean. All right. So can you turn around, please? Come. I'm gonna go behind you. I'm going to check here between the crack wood right here. Can you swallow, please? Okay, I could feel it. Right? Okay, so this has concluded my HEENT assessment. Thank you very much.